duly absent with notice. Commissioner Spez?
Here.
And Commissioner Woodward is ex officio. And Commissioner Powell is on her way. Commissioner Gingell?
Here.
Commissioner Loop?
Here.
You have quorum.
Thank you. Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first order of business is approving the minutes for May 13th, 2025. I have a motion by Commissioner Gershenson, support from Commissioner Spiz. All in favor say aye.
Aye.
Opposed? The minutes are approved. Next item is approving the agenda. I would like to make a motion. I have a motion by Commissioner Gingell and support from Commissioner Gershenson. All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment for this meeting. It is for items on the agenda. Is there anyone from the public wishing to comment? Seeing none, public comment is closed. We have 3 presentations today. The first is from Children's Village and Juvenile Justice Updates with Barb Henke. So thank you for coming to the front of the table.
Thank you. Although I'm maybe looking behind me so I can see where the slides are.
Yes.
So good morning. My name is Barb Henke. I'm the Director of Public Services, and with me today I have Heather Calcaterra. She's the manager for Children's Village. And I want to thank you for this opportunity to present some information to you this morning. As many of you may be aware, there's several projects that we have going on in Children's Village. Many of them are midway to, on their way to being completed, so we thought this would be a good opportunity to bring you up to speed on what's been going on. So wanted to start a little bit with an overview because I know some of you may or may not be aware of everything that we do at Children's Village. So Heather? Oh.
So good morning, everybody. Thank you for having us. So just kind of a quick high-level overview. Children's Village is licensed by the Division of Child Welfare Licensing as a child caring institution. And so we actually operate under 3 different licenses. We have a license for secure detention services, a license for residential treatment services that includes both secure and non-secure, and then we have a license for shelter care services. It's important to note that the shelter is the only program on campus that provides services to abuse and neglect kids. It's also the only program on campus where we have a contract with the Department of Health and Human Services. So we actually accept kids from across the state. As a licensed child caring institution, we are actually regulated by DCWL, and there are rules that we have to follow, rules that specifically apply to child caring institutions. I'm happy to let you know that we meet the standards, all of the standards, and in some cases, we actually exceed standards. And just kind of a quick example of that, licensing would tell us that we can have 1 employee staff up to 10 kids during a waking shift, and that would be your day shift and your afternoon shift. I'm happy to tell you that in all programs, we actually exceed that staffing ratio with 1 staff to 6 kids, 1 staff to 8 kids, and actually in our shelter program, oftentimes we provide 1 staff to 1 youth, and sometimes even 2 employees to 1 youth, based on the acute needs and the mental health. So that's just kind of a high-level overview of Children's Village. And next, I kind of want to draw your attention to our beautiful campus here. This is an aerial view. It's a beautiful campus, and many of you have toured, and we appreciate your time that you spend with us. Lots of trees, lots of wildlife, lots of green space, and we've really done our best internally to make the most effective use of all the buildings on our campus. We have a couple vacant residential buildings because our census on campus is lower than it has been in the past, and that's been an intentional move, and Barb will talk a little bit about that. But we took the vacant buildings, and in one of them, we created a dedicated training space for our employees. So we now have a training center complete with computer kiosks and just a place where people can really learn and become enriched and build the team. We took another vacant building, and that is now the spot where we will house our soon-to-be community-based programs. We have a day program coming and also some weekend restorative justice programs. And then we've done some cosmetic things. You know, we've painted walls, we've hung posters, created a sensory room, and even a detention library. But I think it's important to note that these buildings were all built in the 60s and the 70s. And so back then, people weren't talking about trauma responsive care or, you know, the needs of our employees, the needs of kids. We built a structure that was safe, and that's what we did. And so it's important to note that all of our buildings require some form of renovation in some form or fashion. And in fact, one building has already been taken completely offline because of the cost of renovations. And so Barb's gonna talk a little bit more about that later, but just to kind of get us started.
So all the things that we're gonna share with you today really could not have been done without the generous support that we received from so many folks, particularly the County Executive David Coulter, Deputy County Executive Medea Tarek, and really the entire executive administration who understand this mission and who are willing to embrace this and walk this road with us, from all the commissioners on this committee and all the commissioners at large who have appropriated money to support many of the projects that we're doing. And of course, to the staff, our dedicated staff, who show up for work every day and often do this very, very difficult work. Because it really does take a village to operate the village. And so we're happy to say, because of the hard work that's been done, all three of our licenses are in good standing with both the Michigan Department of Health and Human Services and, as Heather said, the Department of Child Welfare and Licensing. There was a surprise audit, which the state does from time to time, on Mandy's Place just about 2 months ago for our shelter care, and some of the findings are up here on the screen. They were all very good. The residents indicated that they felt safe. They found the staff to be well-trained and talked about youth-centered approaches. So we were very happy about that. And really, in addition to that, because of the facility being so well-run, the state is now referring other agencies to Heather to share her knowledge and her expertise on how programs should be run. Recently, they referred Vista Maria to Heather. I'm sure that you have seen that coverage in the news. We've also really made a conscious effort to up our game on the state level, to have an impact in the state, at the state level. Heather was appointed by Governor Whitmer to the Residential Advisory Committee, where she's been very active in the detention subcommittee. She's also the current vice president of the Michigan Juvenile Detention Association. And just recently, and they're coming actually tomorrow, we were advised by the state that we have been selected as a site where they're going to bring the Office of Juvenile Justice Delinquency and Prevention in, because the OJJDP is auditing the state, and they want to see our facility to make sure that the state is doing their job and oversight. So we were, we thought it was a pretty good honor that the state would pick our facility for the feds to come and audit them. So to take you back just a little bit, the reason that we've gone down this road is back in 2021 or 2022, the state, the governor, initiated the Michigan Task Force on Juvenile Justice Reform. And the charge of that committee was really to make recommendations that would improve juvenile justice outcomes. There had been a couple of high-profile cases, and the state had been under federal consent decree for a number of years. So this task force was formed. And they came up with these 6 objectives to guide their work. And these were very intentional. And basically, they wanted to safely reduce the number of kids in detention, increase safety and well-being, reduce racial and ethnic disparities, improve the efficiency and effectiveness of the juvenile justice system, increase accountability, and better align practice with actual evidence-based and research-based methods. And so we have also used these objectives to guide all the work that we're doing. The recommendations resulted in a package of bills that was termed Justice for Kids and Communities. It was a package of 19 bills. Those bills were passed in December of '23, and they did a number of things. As you may recall, there was an elimination of the fines and fees for most fines and fees in juvenile cases. There was a requirement to use assessment tools in the decision points across the juvenile justice system. There was an expansion of eligibility for diversion. And there was also the expansion of, or increased reimbursement to 75% for community-based programs. While all this was going on, we were also working very closely with our court partners. We had started a small work group, which then morphed into the Juvenile Justice Implementation Team, which is required under the legislation. And that team includes, the court, the prosecutor, people from Children's Village, police, the school district, people from administration, Mike Andrews for the Board of Commissioners, Oakland County Health Network, Oakland University, and many, many others. So while all this was going on and we convened this work group, we also wanted to focus internally specifically at what we were doing in Children's Village and make sure that what we were doing there aligned with those objectives. And so we began some internal planning. We developed a vision, mission, and value statement that was driven by the staff. And we also applied for ARPA funding to complete a couple of these major projects, the resource inventory and the campus-wide assessment, which I'll talk about in a minute. But first, I want to turn it back over to Heather to talk about our vision, mission, and values.
So we began to look at our mission, vision, values. We knew it was important because really that's the foundation of all the work that we do, right? You can't build the house without the foundation. Medea would call it our North Star, and we needed a North Star. And so what we did is we assembled a group of employees from across the campus. We're a 24-hour facility, so we have 3 shifts to consider, and we have multiple classifications. And so the mission, vision, values you see on this board is not just my vision or Barbara Medea's vision. It is really a collaborative vision of Children's Village employees on behalf of Children's Village. A safe and healing community where youth are valued, confident, and hopeful for their future. Really meaningful work that the team put into this, and it was well over a year of work and meetings and really trying to perfect it. Mission, to create a trauma-responsive environment where youth thrive to reach their full potential. And then, of course, a series of values: safety, honesty, transparency, all things that are important as we do the work that we do at Children's Village.
So as we were doing this work, there were several objectives and activities that were identified that we could work on, and we began work on those. And we've sort of loosely termed them, short, intermediate, and long-term activities. And so we want to take a look at some of those activities we've been working on. So to begin with, we've had some of our short-term activities.
Yeah, and this is not an exhaustive list, just some highlights, but we contracted with Aurora Health this year to provide trauma-responsive training for all employees at Children's Village. Whether they have direct contact with kids on a daily basis or not, we really wanted it to saturate the entire campus. And so we trained every single employee, and even some of our collaborating agencies, like our licensing consultant and some of our partners from community agencies. We created a detention library that now has more than 1,000 titles, and thank you to anybody who donated. It really was a project that I was very proud of. Our librarian has dedicated herself to this mission. We now have a book club for the detention kids, and they go on virtual field trips around the world, so they can really have a lot of different experiences. We're now collaborating with Genesis Credit Union. We hosted our first ever financial literacy fair. I'm happy to tell you that as a result of the generosity of the Children's Village Foundation, Medea, and also Genesis, all the kids that participated in the literacy fair get a savings account with a $100 deposit. And just a fun fact that Barb and I learned kind of going through this process, in 2013, the Center on Assets, Education, and Inclusion from U of M indicated that a low and moderate income child who has a school savings account between $1 and $499 prior to reaching college is over 3 times more likely to enroll in college and 4 times more likely to graduate. And so we are really happy to be part of that positive momentum. We also understand the need to give everybody a voice, and when we say everybody, we mean our kids. And so we have a youth advisory council, and so they meet with me at least quarterly, usually more often than that. And I'm proud to tell you they've tackled everything from redoing all of our menus to bringing credit recovery services to detention, all the way down to the quality of blankets and underwear that we buy at Children's Village. And so these kids are very serious, and who better to give input than the kids that are living there on campus. We're now attending multiple job fairs and partnering with CEO, which is Center for Employment Opportunities, so we can actively try to recruit and hire justice-involved individuals. And we work with the state. We recently reduced the capacity at Mandy's Place from 10 kids to 8. And I know that might not sound like a significant move, but based on the acute needs and the trauma and the mental health of these kids that we're getting at Mandy's Place, and a staffing ratio of 2 to 1, 1 to 1, we really felt that 8 was more reflective of the work that we're able to do. A safer environment for the kids, we're more able to provide treatment and safer for the employees. And then we've got some employee initiatives as well. We partner with the Sheriff's Department, so we have the canine comfort dogs on site every month or every other month. We do campus events where we provide ice cream trucks or we do barbecues. We bring retirement people on site to meet with our employees because they can't easily leave our campus. COVID and flu vaccines, and soon to be, we're gonna have staff massages. So we're really trying to take a look at everything and continue that forward planning at the village.
Some of the more intermediate things that we've been working on, as Heather said, we're starting what we're calling a day justice program or a day reporting program, where staff will pick up kids in the community, bring them to the village where they'll attend school, their therapy group programming, and then they'll be returned to their home at the end of the day or in the evening. And this is so that they can stay in their communities, because the research shows that they do better when they're in their community, but also receive the support and services and programming that they need. I won't go through all these for the sake of time, but last year we contracted with Beyond Basics, which is a literacy program that we brought to Children's Village. I'm happy to say that we saw a several grade increase for several of the residents who went through that. In fact, one young man tested at the 4th grade reading level, and he was going to be entering the 9th grade. He increased 5 grade levels, and when he left the village and enrolled at Royal Oak High School in the 9th grade, he enrolled at a 9th grade reading level. So we really are doing things that will improve the outcomes and the success of our residents. And one of the things that we're really proud about doing is, and I think I've mentioned this in some meetings before, is we contracted with King Media because we feel it's important to change the narrative that not only the public, but some of the staff and even our residents have about Children's Village. And while I don't want to give everything away, these are the 4 finalists for our logos. There's also a whole media campaign that'll go with it. We have made a decision, but we're going to be doing a reveal a little bit later, so I don't want to spoil the surprise. But again, this was done with staff input. Staff have selected the logo that they feel reflects them and the work that they do within the logo. And so will be more to come on that soon. And then we have sort of our longer range activities, which include our ARPA projects. And also cultivating, a new culture, a more collaborative and cohesive team culture. And there's a saying that goes, culture eats mission for breakfast. And, that's because culture is a really difficult thing. Culture drives your organization, and it can be really, really difficult to change, particularly when you've done things the same way for a really long time, or when the culture doesn't exactly align with new mission, and there can be tension. But there's also a saying that goes, once you know better, you have an obligation to do better. And now we know better, and so we must do better. We understand that it is our obligation to provide a safe space for the residents and staff and to keep the public safe. But we also understand now that it's our obligation to provide spaces that are trauma responsive, that promote safety and well-being, and that build resiliency. And those 2 concepts aren't mutually exclusive. We can in fact do both of them at the same time. And so that's really what we're looking to do. And with our first project, and again, you probably heard me talk about this, with our contractor, the Crime and Justice Institute, which is a national organization. It's our resource inventory and directory. One of the things that they're doing in building this directory is also looking at where there are gaps in the services. Oakland County has a lot of resource, but those resources aren't available in the same way to everyone. And so we're looking at how do we make those more accessible? Where are the barriers that certain populations are facing, and how do we eliminate those and really target the resources that are needed within the community? So the gap analysis should be done by about mid-June, so we'll have that report. And then the next steps will be actually building the resource inventory and working with our IT department to do a governance structure and a sustainability. How do we keep this going? Our next project is with AECOM, and it's the campus assessment. And this is really our vision for what we hope Children's Village to look like next 5 to 10 years. What is our future state? Where are we going with juvenile justice? So there were a couple things that AECOM highlighted, and there was one in particular I wanted to draw to your attention because it was voiced by both the staff and the residents at Children's Village that we need to move away. There needs to be a shift away from this institutional environment. We need to move from punishment to rehabilitation. And that was something that was cited, again, by both the staff and the youth at Children's Village. And they acknowledged that the environment can negatively impact both their behavior, their mental health, and their chance for a successful reentry into the community. And here are just some quotes. And there's one in particular that I wanted to draw to your attention where one of the current Children's Village residents said, "We need light where you can look out and see trees, not bricks and wires." And so these are some of the pictures, if you haven't been to the village, of our current facility. The one thing I think that you'll notice right away is there's not a lot of natural light. This is the hallway down our detention, one of the detention wings, and all the rooms are side to side. It's a pretty long hallway. Up in the top right-hand corner is actually one of the resident rooms. And you can see there's a window there, but it's up pretty high, so light comes in, but you can't see out. And because they're up so high, it makes it really hard to clean. They're pretty nasty. So I don't know how much light actually is getting in. In the lower right-hand corner, that's our sensory room, and it was very innovative, and we get a lot of kudos for doing it. But those are all fluorescent lights. There's no, natural light there. This is one of our outdoor rec areas. I don't know if that makes you feel like really, gives you any peace to visit. Everything is hard and fences and concrete. And then up in the top is a room that we use for visitation and other things. It's just really not conducive to creating interactions with family and staff. So this is just a little sneak peek at what AECOM is proposing. Different type of detention layout where you can see that there's more of a pod type layout, smaller number of rooms together, so it's easier for staff to get to all the rooms. Each pod would have access to an outdoor space. We know that outdoor space is essential to well-being and health, and so residents would be able to access that when they needed it. Couple of different types of room layouts, again, where residents can actually see out and take advantage of the beauty that we have on campus. And what you'll notice in all of these pictures is the use of natural light coming into the spaces and really just being much more interactive. And then these are some of the support and communal spaces. If you've been to the village, our lobby is not very welcoming. And all of these pictures are actually from juvenile detention spaces and youth spaces. So it can be done, and it is being done in other areas. So for our next steps, all of these projects are sort of coming down to the end, and so we will be bringing the final recommendations from AECOM to you soon and sharing those with you. We'll also be having the launch of the juvenile directory that'll probably be next summer. And also the logo and campaign reveal, which we would like all of you to attend because we're very excited and very proud of that work. So you have our email addresses if you have any questions or follow-ups. All of us would be willing to answer any of those or discuss any of these projects with you further. We appreciate your time.
Thank you. Will we provide transportation for the Day Justice program, and when will that program begin?
The program will begin on June 16th, and yes, we will be sending out 2 vans every day to transport the kids.
Any other questions? Commissioner Cavell?
Sorry for being late, but has there been any conversation, and maybe it's too early because you're gonna come back with the money ask, it looks like, but talking about federal appropriations, earmarks, or congressionally directed spending, or state budget, trying to get in there with Phil Green or any of them?
Those are all, it's always like the chicken or the egg, right? Like, how much money do we need? Well, what do we want? And so we thought we'd start with, let's lay it out what we would like our vision to be, and then talk about how we fund it. So we haven't, approached that question as of yet.
Anything else? All right, thank you.
Thank you.
Thank you, ladies.
Our next presentation is Alliance for Housing Shelter Capacity. So we have Leah McCall and Khadija Walker-Fobbs to present this.
So Leah had to join us virtually. She'll be kind of driving it. I will sit here to answer questions, but this is really a report out on the really exciting work that has happened over this year with those emergency shelter expansion dollars that you also generously supported. And so we wanted to make sure that we could share some of the impact that's happened, like I said, even this winter season around this work. So I think Leah can do the introductions and drive.
Good morning, can you hear me?
Yes.
Oh, great, thank you so much for having me. I do apologize for not being there in person. I am Leah McCall with the Alliance for Housing, which is the continuum of care in Oakland County. And so we really work, just as a brief overview, as sort of an umbrella agency to help with process and services and act as the fiduciary for a large chunk of state, federal dollars and other foundation dollars, et cetera, that come through the county for homeless response services, which includes prevention as well. So today, I'm gonna talk to you just a little bit about the shelter overflow and some of our prevention responses. I have some numbers for you for some of our homeless response, and then of course, any questions you might have along the way, please just let me know.
Thank you.
All right, I don't think I'm in control of the slides, correct? So, okay, thank you so much. So this is how the budget was broken out. So our brick and mortar shelters, if you will, Lighthouse and Hope shelters received funding, as well as our seasonal winter shelter, South Oakland Citizens for the Homeless. Kids Empowered on the Move provided some hoteling, and then the Alliance and Oakland County ended up being the proud owner of some beds that we were able to move and use them seasonally when needed. We also received $30,000 for admin, and that is how the admin was broken down for the Alliance's work with this project. So we did do HMIS data entry for any non-HMIS users. That is the Homeless Management Information System that everything is entered in, specifically state and federally, but also to help track and show, if you see data reports nationwide, that's where these numbers come from. So we thought it was important to make sure that these shelter numbers were also included in this work. We did provide some HMIS training because even though we did the data entry, we needed to make sure that the users were, the paper forms with individuals they were interacting with. Also billing to the county, reporting, compliance with the funding, and of course, just coordinating in general with stakeholders and making sure that people were able to access these additional resources. I have, for each of these data points coming up, I have the pie chart or the chart, and then also the numbers. So you can click on this one first, and then the second one is just a little bit easier to kind of read and look at. So total, we were able to serve an additional 307 people between the months of December through March. That is very telling, I would say, of the gap that we have with our emergency shelter response. And again, some of those individuals were placed in hotels, some of them were at an overflow site, some of them were at a rotating church for SAC, and then they also had individuals on site at Star Presbyterian, the church that they resided. Here's our gender information. And again, these we can go through quickly. I believe you'll all have this as well. If you could just go to the next slide, easier to see. You can see the breakout between male, female, transgender, and sort of other identities. Next slide. Age. We did have a good amount of children within this program, within some of the family overflow we were able to do through the sheltering and through Lighthouse. Here's a breakdown of the ages. Oh, sorry, you can go to the next slide. It just, there you go, there's the numbers.
Are we allowed to ask questions?
Please jump in anytime.
Spiz.
Yeah, thank you, Madam Chair. I do have a question on this, because I looked at that chart, and I looked at this, or the graph and this chart, and if I understand it correctly, so correct me if I'm wrong, there's many, I'm gonna call them larger families, because the kids outnumber the adults.
Absolutely.
Look at the numbers.
Large families, and that is another reason that it's hard for sheltering.
Is that the
Lighthouse
case?
is our only
Did you hear
family
that
shelter,
question,
does
Leah?
have the ability to configure and make space
You go from,
larger,
like,
then
500
that
to
reduces the
30,
number.
yeah.
Oh, I'm so sorry.
But you look at the front half of the chart, right? Or the graph there, and you compare
Yeah.
that to the middle section, which are most childbearing ages, seems to outnumber, so that leads to me believe that there's a lot of larger families
families, yeah.
that are associated
Correct.
with this.
Yeah.
Okay.
Yeah.
And I believe I know that with Kids Empowered and Lighthouse, they were seeing a lot of families with children, because I know we were kind of addressing some of those needs, and I think even with the overflow, Leah, you would have the specifics on it, but I believe even on the overflow, we were trying to kind of scramble to make sure there was accommodations for those families,
Correct. Yeah.
correct? It sounds.
All right, here's our next slide.
Leah, can you hear us?
Oh, yeah. Can you hear me?
Good loser.
Can you hear me?
Now we can.
Spiz.
Oh, I'm sorry. I could hear you the whole time. Yes.
No.
All right, you can hear me?
Yes.
Okay, great. So race and ethnicity, not a lot of surprises here. Well, I guess actually sometimes Black African American is a higher ratio than white, but you can see in this chart that, or in the next, which is easier to sort of see with the numbers, they were fairly equal. And I'll just pause if there's any questions, please just jump in. Disabling condition. So really we collect this information to help assist with specific housing programs and projects that we can connect individuals to, as well as other services. I would say a lot of times, if you could just go to the next slide, this is underreported. You know, sometimes people are coming into shelter meeting someone for the first time and aren't ready to disclose some of the issues that they have going on or barriers that they have. So usually these numbers are a little bit underreported, but as you can see, many reported disabling conditions that could affect housing.
Commissioner Spiz has another question.
That drives a question for me then. So how do we determine these conditions? Is it just like a short interview when they come into a shelter, or how do we understand and how do we categorize them based on that?
Yeah, so that would be the initial way, right? So when they come in, initially asking those questions, and then after time, in a situation where they're in a shelter long-term, being connected to other resources and housing, seeing other people being connected, a lot of times, some of those conversations change and people feel more comfortable disclosing, and then that information is then updated.
Okay, thank you.
Yes. All right, prior living situation, so you can see that the majority of people came from a place not meant for human habitation. That would be staying in a car, abandoned building. Many came from emergency shelter and or a rental subsidy that they had, with no subsidy that they ended up leaving that situation probably through an eviction.
And I just wanted to interject when we were looking at that chart, I think with the numbers being so high for a place not meant for human habitation, it just really shows, once again, the need that this, initiative this winter really filled for people, even within Oakland County. So I just wanted to elevate that.
Thank you, Khadijah. Source of income, so this is what we collect on their entry. You can see it ranges from no income to earned income, many individuals receiving Social Security or disability. this is a typical sort of pattern I would see within our year-round shelters as well.
I do have another.
Best.
Thank you, Madam Chair. If you go like no income, for example, is that at the time they're come into the shelter, or do we put boundaries around that? They haven't had income for the last 2 months, 3 months, year? How is that categorized?
Yep, so that is at entry, and then is updated at exit.
So you have a different graph that shows that, actually probably the same, but actually it could be different. So you have one at income and one at exit.
Correct.
all-
It is not
We
necessarily.
may not have shown a slide with exit because there probably, we showed some destinations as we get through it. There probably wasn't a lot of changes in those short times, although many individuals were connected to housing. That doesn't necessarily mean that, you know, their income specifically changed. And I will note, you know, the higher number of social security and disability, right? Those numbers don't change, so
Right.
that the lack of affordable housing and or subsidies that are available often is some of the issues that individuals have that are unable to have earned income.
And I think just to kind of speak to that too, the goal being to make sure people had a place to come to get connected in. But it was completely short-term, like 10, 12 weeks, right?
Gotcha,
So,
fair. It's just, maybe it's just me
Sure.
being nosy and liking information and data.
yeah.
It'd be
no.
good to understand when that line of the sand happened from the no income, is it? Because if you're losing housing, I would expect to be a longer duration, but I don't know that to be true.
It's a good point.
Yeah, and I mean, we work with individuals to help them gain, even starting at the shelter level, gain an income, or if they're eligible for social security disability, work through some of those processes to help them apply. And a lot of times, here you can see non-cash benefits, so we really work to help them get any and all benefits that they would be eligible for that will help offset some of those costs when they do have income. It still usually isn't at the level that can support housing, food, family, you know, all transportation, all of the needed things. So here you can see sort of those non-cash benefits that individuals came in with. So if an individual didn't, we would connect them to those services as well. Length of stay, so this was really determined by the length of time that we were able to provide the emergency shelter services. So this doesn't necessarily mean that they wouldn't have stayed longer or less, just depending if they were connected, they may have left on a shorter time frame because they were housed, or they maybe had, you know, housing opportunities, friends and family, different connections that they were able to do to leave this situation. And then exit destination, so this is where individuals exited to from this overflow time. So some were connected to housing, you can see that many were not. Some were not interested in housing and exited back to, you know, places that they were comfortable with, meaning friends, families, place not living habitation, could be a vehicle. It was still pretty cold in March. All right, any questions? That's the end of the data piece of that. Anything else before we move through?
Well, we're moving along, so keep moving.
Okay, great. So the insights that were gained, as you can see, I won't read to you, but you know, a lot of it is capacity, right? So even though we had this additional beds and additional time, if we aren't able to quickly move people through and into housing, they ended up staying the duration of the time that we had these funds available. So capacity is a big piece of this. Some were referred, I would say some, all were referred to the HARA, then just depending on their situation, depending on case flow, depending on the project and end time, they may not have been connected to other housing resources during the stay in the overflow shelter.
Could you define the HARA for everybody here?
Sure, I'm so sorry. Housing Assistance and Resource Agency, and that's really our coordinated entry call number, which is Community Housing Network, our housing resource center. So anyone that is experiencing homelessness or housing instability is asked to call and be screened at the HARA level. If they're in shelter, the shelter does do that piece, and so they don't have to call the HARA, but if somebody is staying in their car, et cetera, they would need to call the HARA to be connected and screened for housing opportunities. All of the individuals that were in this overflow project were screened at the HARA level.
Commissioner Cavell?
Thank you. On this in Insights Gains, it says, due to limited financial assistance options, not all clients are actually served with housing funds. Can you explain more about what that gap is and why it exists?
Sure. So there is limited funding, as many of you know, and I'll try to explain it in the most cohesive way, so please ask questions if it's clear to me, but trying to re-explain it. So an individual is screened and prioritized. It goes by a variety of information, how long they've been homeless, do they have any disabling conditions, family size, a variety of things, and then everyone is screened the same way. We are able to serve those with the highest needs first with the limited funds. So that means some individuals are not even eligible to receive that funding. Are they homeless? Yes, but they may have a higher income and aren't eligible for the housing subsidies that are available. They may have a large family and be waiting for a long time to find a unit that would fit the needs of their family. So there are many reasons why people could be in process or not served at all. And so if somebody is doubled up, staying with family or friends, even though that is they don't have a home and a lease in their name, they're technically not eligible for homeless dollars, meaning security deposit first month's rent. So,
Okay, cool.
any more or follow-up? Yeah.
Yeah, so you said that you served this funding, the $400,000 was able to serve about 307 people.
Yep.
How many, I guess just broad strokes, the PIT count says there's how many people that are homeless in Oakland County? How many we served was 300 over the winter. How many were missed, if any?
How many people were missed that were not served and turned away? I'm sorry, is that your question?
Yeah, basically.
You know what? We don't have a really great way of gauging that number. So that is something that we're in the works of as we build a web-based app to collect that information. Right now, it's if the shelter is full and you're turned away, the shelter may tally those marks, but it doesn't really all come together in a usable way to show that data and that need. Do we miss individuals? I'm sure we do, right? We're going out on the PIT count one night in the middle of January. So if somebody's able to stay with a friend that night, but every other night they've been out on the streets, we wouldn't see them that night. So I think it's a best estimate. And it's just one tool that we use. We also, look at those individuals' length of time in shelter, how many times they've been homeless or returned to homeless, and put all of those pieces together to really sort of tell the story of need. And we'll be able to do better at individuals that are turned away from shelter and what that need will be when we have completed the web-based app and really that pieces for shelter, we'll be able to show the inquiries and the need that individuals are looking for shelter.
You mentioned when individuals are turned away from shelter. So if I show up to XYZ shelter, how often or how regularly do people get turned away?
Every day.
Because you said the word PIT, so I'll just, for those who might not know, that's the point in time count that is conducted every January and reported on the HUD site of how many volunteers can go out and physically count those who are sleeping places that are not fit for habitation. And I'm just going from memory, Leah, but I believe this past January, Oakland County was maybe around 1,200 at the point in time count. Does that sound right? Or do you have that data point?
So unsheltered, so individuals we actually found that night that were not in shelter was 43. And individuals, we also count those in shelter, right? Because technically they're homeless, they're in a shelter or they're in a housing program that's being paid for. That is about 239.
Where's the 1,200 number? Because I see that reported often for us. What does that encompass?
I'm sorry, I missed the first part of your
The
question.
1,200, between 11 and 1,200 has been reported consistently.
Yeah, so this is just one night. That's overall throughout the entire year, right? So then those numbers are calculated for individuals contacted, served. I would have to pull it up on our dashboard to give you a number right now, but 1,200 would be for the year. that would just be, that those two numbers I just shared is one night of a year.
And we have about 220 beds.
Correct.
So that just kind of gives a little idea about the need and where we know there's a gap and we know there's more, we know homelessness is probably 4 times the rate of what we can count. But
Right.
that just gives.
And ideally, right, if we had, you know, we sort of get bottlenecked, individuals that do get into shelters sort of get stuck there because there's not a lot of affordable housing or a lot of options for them to move out of shelter, so other people can have a brief stay in the shelter, that's the ideal. Then they're there for a longer period of time, working to get connected to affordable housing. So it's sort of a two-sided piece of the need of that emergency shelter that should be quick and brief, and then exiting into affordable housing. And so I think more beds is needed, but that's not necessarily the answer because it needs to be both sides that are addressed.
Thanks. So we utilize South Oakland, Kids Empowered, Lighthouse, and Hope for shelter capacity. Is there any conversation around purchasing or leasing Star Church that we'd be able to add to our list of beds?
Yes. We've had several conversations. Go ahead, sorry. Go ahead, Leah.
Sure, I was just gonna say, so SOC did utilize a rotating shelter method, so they did have churches that helped and volunteered and supported individuals. And then they also had an additional 50 on site for the month of March. So they are gearing up to have individuals in-house, if you will, instead of the rotating piece of it. So there's more stability and just being able to use the facility. And so that is something that they are working towards.
But
I don't know if you have
I
anything
know
to
they're
add.
dependent on volunteers and the donations from the church, which is decreasing. Is there any availability for the county to support Star Church?
Yes.
To resources?
Yeah, not with, so we did use the funding from the seasonal dollars to help kind of give them a boost. So those beds that were purchased that the county and Alliance owns went to help like expand the shelter operations. We used some of those admin dollars to support their new executive director who started several months ago while they could build capacity, get a security person in. We also have been trying to build that relationship so they know to apply for those funds. So Lee, I know those applications go directly to you all. It comes from us as the county. We funnel it to Alliance and then it's distributed. So I know they missed applying in the past, but I believe now the new executive director understands to apply for those dollars through MSHDA's funding and the Emergency Solutions Grants. Anything else you have to add on that?
Yep, so they are aware, they are in the timeline of those dollars, and we're not always able to fund new shelters, but we are able to do that this year with the MSHDA application that has come out, and so they are aware and will be applying for those dollars, so that's more of a stable ongoing support.
Thank you. Commissioner Cabell?
Thanks, just because we were talking about it earlier and you made me think of this, Chair. You talked about how many people are on Medicaid and have mental or physical health issues. What, if any, thought is like being considered with the looming Medicaid and HUD cuts? Because you're fully funded through HUD.
So I can't speak to the Medicaid side of that as the fiduciary. Those pieces don't come through us and some of that information. I know that other agencies are aware and looking at some of those things. So all of our agencies have received their grant agreements for FY24, which was completed last summer. None have been cut, none have lost funding. I do know that the FY25 application that will come up this summer, they've talked about flat funding, but none of the HUD cuts have directly affected the programs in Oakland County, except for to say that those HUD staff that we rely on to help with, if there needs to be budget changes or different things with our grants are pretty much gone at the Detroit office, and so they rerouted us to some other folks to be connected to, but that hasn't directly affected us. We weren't sure. Some of our grant agreements language have changed with some things that I would say not all of the agencies are comfortable with, but if you don't sign those grant agreements, you don't get those funds, and so we're working through to best still serve the individuals and comply with the executive orders as well.
Okay, thank you.
Commissioner Gensel?
Yeah, thank you. So I appreciate it. I mean, clearly it's a situation you're trying to solve. This is kind of a temporary Band-Aid. One bullet maybe to consider on the lessons learned is there a parallel economic path? So I'm not sure of all the individuals and their capacity or capability, but as they come into shelters, temporary or not, is there an opportunity, or how do we better align them to economic opportunities as well so that they can begin driving incomes that allow them to stop being homeless? And it's a challenge, right? It's not easy. I totally get it.
Yeah, and so I think, to your point, we have a really great connection with Michigan Works, and anyone that, has the ability to work and be connected is connected. Even individuals on Social Security disability, we are offering information that you can work, if you're able. You just have to make a certain amount that won't affect your income. So really connecting on all of those pieces, MRS, anywhere that we can connect individuals. I know the shelters are able to use a lot of, I'm gonna lose the word. I can't think of it. It's the J Shop down the street from Hope Shelter that they can do some, daily activities. So they're doing temporary, there's the word, thank you. Temporary work, and that has led to some full-time employment and employment for individuals. And then addressing some of the other barriers that sometimes are in place, like substance use disorders or other mental health concerns, and connecting them to those resources. And then once people, feel more stable and are addressing some of those barriers, a lot of times it then opens up the ability to gain employment and move through some of those pieces. So really supporting through that process in shelter and in housing with some of the housing subsidies that we have available for individuals with zero income to, some sort of income, is really what's needed to provide that long-term support for individuals to get back on their feet.
Commissioner Spitz?
Thank you, Madam Chair. To build off Commissioner Gingel's question, with all that data that you showed earlier, do we take data of the educational background of everybody that comes into a shelter? Does that help us guide?
Yeah, that's a good
placement?
question. Leah, do we capture that in HMIS and do that in intake on the educational background through all the different shelters?
That might not be a shelter intake. Many of our shelters are low barrier, right? So some of the served families do have some other criteria to meet, just so they are making sure that youth are safe in those shelters. But let's use Hope, for example, as a low barrier shelter. So they may not have an ID, they may not have some of that information, they may not remember, some of their educational background. So those types of questions and assessments happen when people are a little bit more stable and working towards some of the barriers that may be in place, like mental health, substance use, and then into housing. So we do ask that later on, but it's not a screening into shelter.
Okay, I guess I wasn't looking at it from a screening perspective, it's more of help them.
When you're connected in the ecosystem.
Once you know
Yes,
that information, I can guide you.
Once they're connected to case management and have more of that ongoing support, all of those pieces are there. Really, at the shelter level, people are just in fight or flight, emergency, piece. But yes, absolutely, we continue and engage and ask those questions.
And I wanted to be sensitive to our time but we also are, I don't know if we'll present on it, Wellness Wednesdays, maybe a little bit further down. That's a partnership that we've been doing under Health and Human Services. I mentioned that, I know we've mentioned it here before, because a lot of the people who were attending or going through the winter shelter were coming on Wednesdays. We did have Oakland 80 there, we did have workforce development there, and we did have mental health services. So we were trying to make those connections for those who were doing the emergency shelter at that time. And so it's new, so I'm sure we'll come back and report. I'm looking at Liam like, I assume we're gonna give a report out. So I think that is part of that trying to make sure we're filling in the gaps and connecting, and we don't probably have the best data at the moment, but we'll have data.
Okay, thank you.
Thank you.
Yeah, and just some of these next slides too, if there's more conversation, are really just some success stories that we asked each partner to give us. So you can see that individuals do get connected, they do get those vital documents that they need, they do move forward into permanent housing. So this story was Jay from Hope Shelters, Joe from Hope Shelters. Some of these next one are pretty small writing, but this was an individual that was aging out of foster care that they were able to connect with and bring into shelter and support, and now will be moving into the graduated assistance program through Lighthouse, which is GAP. As a transitional housing program, so this individual will be able to continue moving forward. Rhonda's story, you can see again, mother and her 4 children were in their car, and they were able to be connected to Lighthouse Overflow for their family and support. This is just a brief visual of how our coordinated entry works. And so at an access point, could be shelter, could be that car number we talked about. We always work to try to divert individuals from coming into the homeless system. Are there family and friends that you can stay with? What sort of minimal supports could we provide to be able to help you stay with those family or friends? Could we help with a utility bill there, or a gift card for groceries if you're staying with another family? The assessment happens at that time, really determining their vulnerability and their need. Then, as we talked about, prioritize those with the highest need first. And then that referral would come into our coordinated entry housing registry for individuals that are literally homeless and are eligible to receive those housing services and subsidies. And I can talk just a little bit about that number before we move on to prevention. So as of 5/27, which was that last Tuesday, we had 330 individuals, not households, households, not individuals, on our housing registry. That means they're category 1 homeless. They are living in the shelter, on the streets, a place not meant for human habitation, in their car. So 330 households were on this registry. So individuals that are chronic, that means they do have a disabling condition, physical or SPMI, and they have been homeless, HUD definition, 12 months without a break, or have experienced homeless episodes 3 times in 4 years. That's how they're designated as an individual who is chronically homeless. We had 61 individuals on the registry for that. Individuals that met the 12 plus months, so maybe they were 12 plus months homeless, but they didn't have a disability, 34, again, households, I keep saying individuals, but these are households. And then not chronic, so it could be first time homeless, it could be a shorter time of homelessness, 209. So sort of anyone else that may be experiencing homelessness that don't meet those specific definitions for the timeline of homeless, and that's really just for specific housing projects. And these are just individuals that were able to meet that prioritization to be added to this. So this number could be higher, but they maybe were able to resolve their own homelessness, maybe their income was too high to receive assistance, it would outpace the subsidy that would be provided, so those types of things. Maybe they were interested in moving out of county, so we help them get connected to another county as well. Any questions there before we talk a little bit about prevention?
Commissioner Cavell?
Yeah, Leah, are there any things that, to what Commissioner Gingell said, this seems like, we're talking about these numbers and there's kind of band-aids we're working on. And yes, one answer is putting a lot of money into this to help these people systemically and structurally. But short of that, are there other things that can be done?
Other things that can be done around homelessness, or just the support of individuals and families?
I guess the support of individuals and families.
Yeah, so, I think, there's a lot of information that goes out through Oakland schools, through the school district to support families. And some of that circles back to some of the work we talked about here, but also just supporting families before they get into this emergency situation. Also through MDHHS, car repair, different types of things, utility assistance. Always looking at education and income and what we can do to help individuals increase that. So I think there are some things when we get to the system that I sort of work with, usually individuals have passed those places, or they have really just been on the verge of needing either shelter services or things like that by a very minimal amount. So it could be something like a car repair, or they're hourly employee and their children are sick and they're not able to go to work. We do have some flexible funding that we can assist individuals with for anything that a grant wouldn't cover, so there's really no limit. And so we do try to reach out to individuals, and when they're reaching out to us, offer some of those services. We're helping somebody pay some tickets, we, have purchased work boots, we've done car repair, we have done storage unit payments so individuals don't lose all of their belongings while they're, in transition. So there are some things that we do to support and really help before they get to this response system.
Thank you.
Thank you. So the next few slides are just really about prevention, so kind of where you were talking about, but really preventing that emergency in the first place. Keeping someone housed is always easier than rehousing them, right? Losing all of their belongings or moving all of their belongings, security deposit, first month's rent, all of those things. So same sort of process, of course, because we don't have enough funding, that they are prioritized highest need first, and you can sort of see that the RIT would be the highest level, that would be the sheriff is coming out to the next day or two to take them out of their unit. So usually we are helping individuals at the judgment stage, so that means they have been to court, they have 10 days to either pay or move out. So that's really how we prioritize those individuals. Sometimes if we never get through the writs and the judgments, we get to the summons and the complaints, but usually we're in those higher areas and numbers, and so we aren't able to do that. You can see some of the funding. Oh, I think this one did have this up. So we also received $1,787,515 in CDBG CV funding. That was able to assist individuals with higher area median income. And so that really means that individuals we were helping, their income was higher than their rent. And that is not always the case. As rents grow and they're higher, sometimes we have individuals that their income is lower than their rent. And sort of a circular problem of helping them get connected to increase their income, but also support and not lose their housing. Some examples, so we had summons, right? So that would not be at that judgment level that they had 10 days. They still had time to appear in court. She had zero income. She was disabled, but has not yet received disability income. So this person was seeking assistance, called the HARA, and was screened, was added to the prevention registry, but as you can see, they would be lower down on that list of prioritization because they are at the summons level. That week in the queue, if you will, there were 4 writs and 29 judgment. As a result, Jane did not receive that assistance. So I assume, many of you get calls of individuals that have a scenario like this or maybe this need. And so really just trying to explain it and answer questions that you might have. It's always easier to help someone before they get to that judgment stage, but we are never getting through those judgments to get to that earlier stage. Any questions here?
Commissioner Cavell?
Yeah, so this reminds me of when we did the CERA program, the COVID emergency rental assistance.
Yeah.
There were like 17,000 households on that list, and it was like $100 million to keep people housed.
Correct.
What are those rough numbers now? And I know we don't have the CERA program anymore, so.
Right, our numbers are in the hundreds that we're able to assist. I mean, it just sort of depends on that funding piece, but we've never had anything like the funding we had with CERA funds.
So you're using Jane as an example, but are there other people falling through the cracks? If you're able to help hundreds, are there,
right.
Oh, absolutely, right, and so Jane may be moving up as she progresses through court. We're able to go through those 4 writs, 29 judgments we talked about in a couple months, and then maybe she is now to the top of the list, if you will. But in the meantime, if somebody with a writ comes in and reaches out, they again go above Jane. So it is there are definitely individuals that we don't get to that we can't help.
Okay, thank you.
And again, based on the funding, if we're talking about the CDBG-CV funds, right, you have to have a certain amount of income or you're not eligible. So somebody with no income, like Jane, there's a minute amount of dollars that we have in that program. But as we're helping catch her up on rent and do that, we're also trying to help her gain income to move that forward so this doesn't happen again in 2 months or 3 months down the road. I think we're coming to the end, so we do have a quarterly newsletter we put out. There is a link in this PowerPoint, so you can click on that there, but we'll be doing updates. Always, if you're looking for data, that's where you can find this, or you can also find some dashboards on our website, oaklandhomeless.org.
Are there
Any other questions?
That was a comprehensive report, thank you.
Thank you.
Thank you.
Okay, our next presentation is regarding the ARPA Senior Center and Volunteerism Grant Update. And Tiffany is here to present this information.
Hello everyone, how are you? Do I need to use a clicker? Or
Yes.
Alrighty, so today I'm here to give an update on our American Rescue Plan Act for our senior centers and our volunteerism grants. I'm gonna start with the volunteerism grants. So basically, we were given $50,000 to do a mini grant for our senior center nonprofit organizations. And within this was a very unique opportunity. We actually had a short window. In March of 2024, I was able to do a brief webinar where we invited multiple nonprofits within Oakland County to really come and have about, I believe it was about 4 weeks where they were able to apply for the grant. Within this, there were stipulations that they had to be a nonprofit organization that focused on volunteerism. And then they also had to be able to figure out how they were going to do to increase volunteers. Within the COVID pandemic, we realized that Oakland County has a very mature older adult population, and we really want to be able to focus and really help them socially, emotionally, as well as those individuals who are physically able to get back out and volunteer, that they're able to participate. The requirements for this grant were that they had to be a nonprofit that provided senior center services, as well as they had to make sure that they were able to use the funds by September 30th of 2026. This is very unique because most of our other funding goes all the way to December 2026. So this was a little different. So the grant is known as the volunteerism mini grant, up to $50,000, and the organizations could apply up to $10,000 per organization. So they had to really figure out on which methods that they were going to use just for these funds. And we're happy to say that all of the organizations that we've awarded, they have received their funding. So this is the list of the organizations and the amount that they were awarded. We see that we have 2 organizations, the Interfaith Volunteer Caregivers in Roseville, $9,000, and also World Medical Relief for $9,000. And the least amount went to North Woodward Foundation. And Commissioner Nelson did send a quick note that she wanted to get a little more information. So I have more information I can provide after the presentation to update. So it'll also provide the different cities where these organizations are located, as well as more information as far as when the reporting status. Because they were actually delivered last year, we had to make sure that all of the funds went out in 2024. So for this program, we will receive our first round of our quarterly reports July of this year. And then they come every quarter from there.
Thank you.
You're welcome. So, wanted to let you know, in March of 2024, we received 22 applicants with a request of over $150,000. We were able to identify 9 organizations, and from there, 8 of the organizations were able to have their agreements submitted and have invoice processed for payment. The reason why we only have 9 that were awarded and only 8 that were
received the funding is because one of the organizations believed that they were going to get the full 10,000 and then realized it could be up to. So they actually had funding that they were banking for a full 10,000, so they ended up declining. And I was speaking with Barbara, so we allocated funds to other organizations to increase their funding. We're happy to report that we were able to have everything signed from our organizations as well as our board chair within the appropriate time, and we are still waiting for our quarterly report to be submitted. So we will send, all of the organizations have been sent out their reporting templates, and they will provide updates as well as letting us know at what status those reports are. So we have 4 status points where they're either not started, less than halfway started, more than halfway, and then fully completed. Moving on to our senior center grants. This was a very interesting grant I inherited. We had about 2 other project managers before I came on for the senior center, so I really had a great opportunity to meet a lot of our senior center staff. They actually had a lot of changeover too, so it was really an opportunity to stay as invested and keep communication as well. And it's been very helpful having our older adult service team work along to visit those senior centers, so that way they give me a little more feedback as they go in to visit daily. So within the background of our senior center grants, this was an opportunity to really focus on our post-COVID pandemic. We really want to be intentional within the county to understand the needs of our senior centers. Oakland County as an older adult population that we really wanted to focus on and figure out how can we make these physical improvements not only to the senior centers but also transportation, and figure out what are some of the needs and interests that these funds can go towards helping our seniors. There was a $5 million amount for this grant, and we were able to make sure that our senior centers focused on different improvements. So we have, for example, the Bloomfield Township. They really wanted to really focus on the improvement of their parking lot. And when they realized going in for quotes that was a larger ask than the funds were allowed. So they ended up going back and redoing their pool. And what they did with their pool was make it a more saltwater pool, so for residents. And the great thing about our senior centers is that other seniors, you don't have to just live within that city, township, or village. You can actually go and visit as well. So this gives another opportunity. A lot of the other organizations decided to really focus on physical activity outside. Our pickleball courts are huge. We have multiple senior centers who have done pickleball improvements, as well as just the everyday improvements of having more ADA compliant services with our doors, ramps, and things to be more functional, such as restrooms. And we're happy to report that more than 80% of our reporting and also are completed within the senior centers. For example, we have Waterford Senior Center. It was a very interesting component with them because they sold the senior center actually to the township. So there were some things, legalities that we had to really go through. So working with Core Council as well as Walt Hersig to really make sure that literally came down to the week after Christmas when we were able to sign all the information. And they have actually reported less than completed within their improvements. From this application, there were 43 applicants, over $1.8 million requested, and we're able to say that 29 grants were awarded. We have 27 city, townships, and villages, and also 2 nonprofits. This is, again, a breakdown of how the time frame the program started in November 2022 for all awards were identified by 2023, and in December 24, everything was fully executed and invoice submitted. Again, we have all of our completed signed signatures from organizations as well as Board Chair Woodward, and we are finishing up with our quarterly reports. They have until December 2026 to submit everything. Here are a few pictures that we have from our different senior centers of the ribbon cuttings. I believe that we have the city of Troy, and then this is the kitchen in Auburn Hills. Are there any questions?
Any questions regarding this item? All right, thank you very much. It's a wonderful update to learn that our monies are going to good use.
Thank you.
I do wish more communities had applied, but. All right, we're moving to our regular agenda item. The next is communications. There are 10 items under communications. 5 are reports. The first from our animal intake and disposition report. We have an ARPA Oakland County Schools Mental Health Grant Program final report, Health and Human Services ARPA reports, the OCHN School Mental Health Navigator report, the OSHA Senior Chore Program, the Critical Home Repair Roofs, Ramps and Repair Program, and the remaining are grant applications. The first to the Michigan Department of Health and Human Services for the Home Visiting Section Workforce Wellness Program. The next is from the Michigan State Housing Development Authority for the fiscal year 25-26 Housing Education Program grant. The third is to the State Court Administrative Office for the fiscal year 2026 Juvenile Drug Court Program. And the last is a grant application for the fiscal year 2026 Combat Veterans Treatment Court Program. Did everybody have a chance to review and Commissioner Spitz?
I did. Do you need a motion to receive and file first?
Well, yes, we do.
I have questions too.
Oh.
I have a
Questions first?
motion by Commissioner Spitz, support from Commissioner Cavell. So Commissioner Spitz, do you have a question?
I do have a question, a couple questions. Thank you, Madam Chair. For the ARPA Oakland County Schools Mental Health Grant final report, I would like a presentation on that. It's a good detailed report, but I have a lot of questions, and I think it would be good for all of us to see it and probably have the opportunity to ask questions. And I'd like to get that whole report sent to the whole board, not just this committee, if that's possible.
Sure.
And then second question I have is more of procedural. I see 4 grant applications on here under communications. If you go down, we have multiple other grant applications. So what's the determining factor between communications and actually the regular agenda?
I will defer to staff.
So when the grant application is under $50,000, it is a communication item. If it's over $50,000, then it requires board action, so then you'll see those under the department recommendations.
Thank you for that answer.
was a wonderful
But
answer.
I believe there's a couple down below that are under 50,000, just ask. That's why I asked, because I
Good
thought that
catch.
was the
Okay,
number.
Yeah.
Thank you.
We can address those later.
Commissioner Gershenson?
So on some of them, there is money left over, and so I'm just wondering about that. What's the plan?
Are you referring to the
Well, the
mental health?
One, for sure.
There has been conversation that they were gonna move that into a different program, but again, presentation
Okay.
with the details. Any other questions or comments on communications? All right, do you wanna prompt the vote? Say it again. Oh, you did, perfect, thank you.
So we can do it either way. You have 6 yeas, 0 nays.
All right, communications have been approved. We move on to circuit court recommendations. There are 2 grant applications. They're both to the State Court Administrative Office for the fiscal year 2026. One is the Adult Treatment Court Program, and the other is the Juvenile Mental Health Court Program. I'd like to make a motion. I have a motion by Commissioner Gingell, support from Commissioner Gershenson. And welcome.
Hi, do you have, I don't know if you're making a motion to go ahead and approve it, maybe we don't even need to say.
Motion to hear about these 2 items.
So as you're aware, this is a continuing request for funding from the State Court Administrative Office. I don't know if you, just to introduce myself first, I'm Chris Bujak. I'm the Manager of Court Business Operations for Circuit and Probate Court. I have with me Ramel Pennick, who is working on our grants and special projects for the court for circuit and probate as well. So this year, ATC, you'll see we have a much larger ask. than in the past. Our recommended budget, ATC, the MDCGP grant, typically yields us 2 different awards. So that single application comes back to us as our MDCGP money and money from the federal burn grant. In addition, though, we're asking for more than their recommended or their proposed amount because OCHN has lost funding from a federal grant that covered the liaison position. Currently, I think by the end of the week, we will have 111 participants in our ATC program. It's an alternative to jail. Legislation changes have really caused that program to just explode because there is for third offense, drunk driving, third offense, or fourth offense, you can choose to participate in that program as an alternative to jail. So we want to offer as many people as possible and continue to not have to cap that program and force people to not have that choice. We're gonna need to find supplemental funding if we don't receive it from SCAO, and so we may be back before you. That's why I'm just going into maybe a little more detail, but just to make sure that you understand there has been a loss of the federal funding for OCHN, which directly impacts that program's ability to serve our participants. For our juvenile mental health court, that program has been here for 4 years and it is growing. We're very happy with the program. I don't know if anyone has questions. I'm still waiting for today's exact count of participants. I apologize, everybody is in court today. But we have roughly 13 participants.
Thank you. Commissioner Cabell?
You said OCHN lost a grant. How much was that grant for?
That grant covered about $117,000 between benefits for one of the positions and then full-time salary and fringe for the other position.
So this new PT&E request for $29,000, it will not fill the full gap?
No, well, the PT&E, the request for the funding to cover what OCHN left or lost is actually in the professional services sort of area of the grant. The part-time position is just because we're up to 111 participants and we have, how many we're waiting? 17?
17, 18.
That we're waiting to enter the program, and we have 2 full-time staff dedicated to that program, but they're finding it difficult to keep up. We are in the meantime taking we're looking at all of our alternatives, but we are asking to see if we can get funding for a part-time position.
So then what might be the gap that you would come back to ask us to fill if?
For the OCHN funding,
What do you call it?
117,000 roughly.
Okay. Thank you. Was it federal grant?
It was a federal grant they lost. And I believe tomorrow at Finance, Brent will be talking about it as well.
Thank you. Any other questions regarding these 2 items? Would you prompt the vote, please?
We have 7 yeas, 0 nays.
Motion
Thank you all
carries.
very much.
Thank you for waiting with us. Our next item is a district court recommendation. It's a grant application to the State Court Administrative Office for the fiscal year 2026 Michigan Drug Court Program. I have a motion by Commissioner Spiz and support from Commissioner Gershenson. And who do we, Patricia Bates online. Thank you. Well, welcome.
Thank you. So, like Circuit Court, SCAO gave us kind of an estimate of what we would get for the fiscal year 26, and that's $138,500. We are asking for an additional $20,494. And right now we have 32 people in the program. We've been in operation since May of 2001, so this is a continuation. It pays for treatment, testing, a peer recovery coach, and a full-time probation officer position.
Thank you. Any questions regarding this item? Would you prompt the vote, please?
7 yeas, 0 nays.
The motion carries. I think we've all decided that's an important piece that we provide for people. Thank you.
I appreciate your help, thank you.
The next 6 items are from Health and Human Services. 5 are grant applications. The grant application for the 2026 Medicaid Lead Hazard Control Community Development Program. An application to the Ballmer Group for the Supporting Community Schools Program for Southfield. Another program for Hazel Park School District. Application to the Michigan Department of Health and Human Services for the 2026 Prevent Elder and Vulnerable Adult Abuse, Exploitation, Neglect Today program. Last application is to the Department of Housing and Urban Development for the program year 2025 Annual Action Plan. And the first item is a grant acceptance from Metro Solutions for the Preconception and Best Start for Babies Regional Perinatal Quality Collaborative Program. Who would like to make a motion? I have a motion by Commissioner Smith, support from Commissioner Gershenson. And welcome Leanne and staff to talk about this.
Thank you. Good morning, everyone. So we are all going to play a part in each of these. So I just thought I would start by saying we are looking under every rock, as you can see, for grants and opportunities to bring money in, because we don't know where funding is going to be cut at this point. So you're going to see us the next few months asking to apply for grants because we're really looking for opportunities. So today we're going to start with Kate. Well, how about we introduce ourselves really quick and then we'll start. So Leanne Stafford, Director of Health and Human Services.
Khadijah Walker-Fobbs, Officer of Neighborhood and Housing Development.
Sarah Gold, Strategic Partnerships and Initiatives Officer.
Kyle Hines, Housing Trust Fund Manager.
And then I'm just gonna turn it over to Kate and she can actually present the first item.
Good morning, I'm Kate Guzman, I'm the Health Officer, and I'll start with the first 2 grants. So the first one is actually an acceptance. We've been awarded $35,000 through Metro Solutions. The goal of this grant was to improve maternal and child health outcomes. So with this $35,000, we'll be funding a part-time public health nurse 3, with the intention to work on our Best Start for Babies collaborative, as well as piloting a virtual education model, which is designed for the public and aimed at healthier pregnancies.
You're welcome to keep moving along.
All right, next one is actually a collaboration between Neighborhood Housing and Development and Health. So Khadijah and I worked on this closely together. It's an opportunity through the state Medicaid program to focus lead abatement efforts on Medicaid eligible families. And so we are asking for just under $700,000 for a 1-year grant, which the bulk of the funding will go toward abatement contractors focusing on ridding houses of lead hazards. But we've also written into the budget a part-time community health worker, which will really work closely with the families on relocation if they need to move out of their homes during the abatement process, but also engaging them in the transition to success model and working with them on resources and any other needs that they might have.
Thank you. Our next item.
Okay, so next, we are here to request permission to apply for our Annual Action Plan 2025 for the Department of Housing and Urban Development for our Community Development Block Grant, our Home Investment Partnership Grant, and our Emergency Solutions Grants. These are the 3 grants that we are typically awarded each year. This year, we have been provided with funding for $3,735,142 for CDBG. Community Development Block Grant is formula-based. It does serve 52 of our communities, and the activities are restricted to low and moderate income families, and it provides a lot of the local public services and work that we do around sidewalks, removing architectural barriers, building affordable housing, which Kyle's going to speak a little bit to some of the new things we've rolled out this year. With that, our Home Investment Partnership Program is a federal grant that is exclusively designed to create affordable housing for low-income houses, and so we've been provided with a funding of $1,869,393 this year. We'll talk a little bit about some of the initiatives and efforts that we have been able to successfully implement this year with that. And then lastly, our Emergency Solutions Grant, which is, you heard from Leah, obviously in our earlier presentation, that is one of the primary mechanisms of support for our shelter operations and work that we do for that. We received $320,372. And so this is our primary funding source right now that does support 24 positions within the Neighborhood and Housing Division. And then we also have in our ask our estimated revolving loan fund from the work that we do through home improvement that comes back every year. So $900,000 estimated for CDBG and $1.4 million estimated for home. And I guess with that, if there's not questions yet, I'll just maybe have you share a little bit high level about how we've utilized our CDBG funds on the housing rehab and build out of affordable housing just this year because it is new.
Yeah, so we had some old CDBG funds that had to be expended in order to meet federal timeliness ratios. So we had the opportunity to invest in 3 different existing affordable housing developments. One Beacon Place with Lighthouse, one called Woodland Heights, which is former public housing owned by Four Seasons Contracting, and finally a current single-family, a 10-unit single-family rental property owned by Venture that is actually being converted to home ownership. We actually closed on our first. We provided all the renovations for each of the single-family homes, and we've already sold one yesterday, closed on it, and then we're working with 3 potential home buyers. Some of them are actually living in there, and they're actually being able to move into the homes that they've been renting, working through housing counseling programs and other home ownership opportunity and financial creditworthiness classes. So that's been great. I will say the 187 units that we have at the Woodland Heights development in Pontiac, it has vouchers, 185 voucher units there. So we're actually going to be preserving and keeping those online. And we were able to use our CDBG funds to do that. And then the last project, which is called Beacon Place in partnership with Lighthouse, is actually gonna be permanent supportive housing it's supported by half the units by project-based vouchers. So being able to use our CDBG funds for this has been a great opportunity. We want to be able to, with our next year, we'll be here with a new comp plan where we're gonna have new ideas for different ways of expending these funds. So having a different approach and different format and working with our community partners on if you have existing housing, but it's affordable, but we're worried about it may fall under, blight or just go away or become market rate or lose the affordable units. We can use our CDBG funds to help assist and maintain and preserve those apartments using this type of program. We also use our home investment partnership funds as well to do rental housing development and single family home ownership opportunities as well. So with that,
And really, once again, this just ties back to that presentation earlier when, we heard from Leah saying that one of the most basic ways we can help is to make sure that we are preserving the housing or keeping people stably housed. So it's been a very strategic investment in making sure that we're putting dollars towards these developments that already had voucher units. I mean, a lot of them were in pretty deplorable condition, frankly. So maybe at some point we'll show you some before and after pictures when everything is done. But it is part of this larger, circular strategy. So
yeah, they call it the housing ecosystem. So with some of our housing trust fund developments, we've already received people with housing choice vouchers. One of them notably a disabled veteran who's able to move from, like Khadijah said, a really deplorable housing unit into a brand new 1-bedroom ADA accessible unit in Pontiac. And so that's the type of thing when we talk about when people transition. And to speak to some of the financial literacy, housing counseling, and some of the other programs that we provide, now that we're actually investing inside of some of these apartment communities where Oakland County has a say in like how you're gonna operate, we can start coordinating with our partners out there to provide some of these additional wraparound services so that we're providing and setting people up for success. So while they're not housing insecure now, they can actually start saving money and then ultimately move on to home ownership. So that's the goal when you have all of the ecosystem, as it were.
And I want to take a moment to compliment this team. So for 7 years, we as a county have not met what's called our timeliness ratio. And so we were in pretty bad standing with HUD. And this team, for the first time in 7 years, met the timeliness ratio. And so that is why we're gonna continue to see the funding, and actually got a little bit more funding than expected because of that reason. So this team really deserves a big round of applause for what they've done over the last year.
Thank you. I love to hear the good news and the progress we are making with affordable housing, knowing that there's more to come.
So we also have a really exciting project. I'm gonna turn it over to Sarah. Not that that's not exciting, this is another one.
Sarah's
So,
exciting.
Working with our schools, so yes.
Yeah, it is. It's super, very, very exciting. We've been invited by the Ballmer Group to apply for, for about $4.66 million to expand our community health worker team to provide wraparound supports to families in both Hazel Park and Southfield school districts. You'll see there are two different grants, one for each school district included. We view them as one project. It was a logistics issue that they had a separate amount, but it's one project for us. These funds will help us place community health workers who will implement the Transition to Success program that you've heard about in a school setting. And we're working with superintendents and with community schools staff at both Hazel Park and Southfield to work out how families will be sort of referred from the school system into our care. What this does is it really takes our ability to serve families into community, which is the primary responsibility of community health workers. It is the model, and it's another way for us to expand those services and really barrier bust issues of benefits and service access that we know are causing delayed access for families in these communities. It's interesting, just some of our initial conversations, we'll be sitting around talking about what are the types of families and circumstances that we will be serving in these school districts, and like every time somebody opens their mouth, Leanne's like, well, we had a program for that. If we had a better system of care for families and a better way to refer in and make it smoother, maybe we could have fixed that furnace, maybe we could have X, Y, or Z. So we're really, really excited, and Ballmer has been extremely generous in opening this application for us. They approved our concept and invited us to apply formally, and we're really, really excited about the expansion of these services and the partnership with the school districts who have invited us into their model to work closely with them on site.
Is the wraparound program you described different from Oakland Wraparound?
This is an expansion of Oakland Connect. Yeah. So it's really our ability to take the model that we're building in Health and Human Services, and I'm sure Leanne can speak to this better than I can. Keep going. But to take that to a place-based setting of these school districts. It's another way to build on the success that we're already having, to expand those teams, add additional capacity within the county. Our hope is that this will be so successful, we know it will, that Ballmer will expand to us in this partnership to new school districts. So we think this is a beginning, not an end, to our ability to do the work in this way. But this will fall under the umbrella of Oakland Connects for us.
Yeah. And just to add to that, these community health workers are from the community, right? Our goal is to find someone that's already engaged in the school district to provide these services, so that the people in the school are familiar with this individual. We're not just bringing somebody that's from the outside. So we'll be working directly with the school districts within the community.
So the school district would identify the person?
They would help us identify, so yes.
Thank you.
And the grant will cover any certifications and training. If that person is not already trained up as a community health worker, the grant will make sure that we get that person credentials and build them into the system.
Thank you.
All right, and then the last one is we are looking to apply for a grant to expand the Oakland County SAVE Task Force, which I think you all are familiar with because you were part of probably creating that. So at the end of last year, I was kind of tapped on the shoulder and asked to kind of take on the SAVE Task Force to help bring everybody together. So we put a health educator to try to facilitate these meetings, and they're doing very well, coming together, finding new ideas. They'd really like to do some expansion. So they're looking to apply for a grant, $75,000. It will be for a part-time staff person to help really support this task force. Currently, we're using health educator that has a lot of responsibilities, and so we really want somebody that can engage all their time in this and be able to help this team move it forward. So that would be to help them really look at the data that's there, identify trends in which we can increase where this task force wants to go, so.
Thank you. Any questions regarding any of these items? Commissioner Cavell?
I've been reading in my day job, working a lot on the Medicaid and HUD and like the HHS cuts. But I don't wanna like be a broken record, so I guess, is any of this are you considering any of this? I see the CHIP, so Children's Health Insurance Program for lead removal. Like, is anything, I don't know, are you concerned about this? Especially if cuts will take effect in 26 for HUD and 27 for.
We don't, I mean, that's the thing is we don't know the funding for HUD yet, right? Because that will not come until next year, right? We know there's gonna be Medicaid cuts. We don't know what that looks like yet and how that'll impact our programs. So that's kind of why we're looking under every rock, right? Like what is available. You're gonna see next month we're bringing additional grants that we found that aren't funded by Medicaid to try to shore up some of that possibly can be cut. So we're working with OCHN, right? Trying to identify honor, like how they're gonna be impacted. So really looking at our frontline agencies that may also be impacted. So I feel like we'll bring that back to this group, but we're still just kind of trying to analyze what that's gonna look like.
Okay, and then I've talked to some philanthropy people in the area, and they've said things like grants can help a little bit, but they will not bridge a gap. Is that something you feel resonate? I mean, you're the philanthropy person. Does that resonate, or is that just hyperbole? Like,
I mean, I think that definitely resonates. I think this, again, we don't know. We're in a place of uncertainty. But from what we do know, the scale of potential cuts outpaces what philanthropy can do. I think I was just talking to the Office of Foundation Liaison this morning, whose role is to coordinate philanthropy and the state. And she said the same, and what they're trying to do right now is help with analysis, help with scenario planning, help with understanding how to not be caught depending on what scenario actually plays out. And I advocated for our needs and our vulnerabilities to be a part of that conversation in Oakland County, and I think that's kind of where we are in the process. Where we can grab funding to stabilize our infrastructure, like with this Balmer grant, we are gonna be, it will impact not only those two school districts, but it brings stability to that social care team by allowing us to expand at a moment when other things might be contracting, and we'll be able to have a little bit more leverage, and I think that's the way we're probably gonna have to play it for a while.
okay, thank you.
Commissioner Gershenson?
So just for clarification, there was a committee that was founded by Judge Sosnick years ago that continued on elder abuse. And I'm wondering if this is the same committee that you recently.
Well, I have two people online. I don't know if they know this answer. Lisa, do you have the history of this? I don't have it. I just was asked if our team could took it on and help facilitate it, so.
Right, well, they definitely needed some help, so if they have coordinated with you, it's a good fit, but I'll look into it.
Okay, well, we can also verify that with our team.
Yeah.
But I don't know that she necessarily has that information.
Hi, I'm here. Janessa may know the answer also. Janessa is also online, but I do know more recently, AAA 1B, whatever their new name is, I apologize, was the more recent coordinator.
Yes,
Janessa, I'm not
that's the
sure if
same
you
one.
know the history beyond that.
Okay, so just so you know, when it was started, or when it was restarted, there was a $5,000 allotment that went to administration, so I don't know if that was.
That's the ARPA, yes, that was sent, I thought it was a
Was it
$5,000.
ARPA? It could have been.
Yeah, we have $5,000 from ARPA, so we know that has to be spent by
Okay.
next year, so
Okay,
they're
so I
working
just
through that
wanted to
as
be
well.
sure that was all.
Yep.
Very good.
Thank you. Any other questions or comments regarding the Health and Human Services recommendations? All right, would you prompt the vote, please? Commissioner Powell?
I just have one thing to say is I also, because I do a lot of interactions with DJ and Kyle, but thank you all. And everybody I've referred to you, I don't get no calls back, so thank you.
We care about all of our residents.
Yeah, y'all do. Y'all do try. But thank you.
You have 6 yeas, 0 nays.
All right, motion. All the recommendations are approved. Thank you.
so much.
Thank you.
Our next two items are public service recommendations. The first is a donation acceptance from the Martha Preston Trust. And the second is a grant application to the Michigan Department of Corrections for the fiscal year 2026 Community Corrections Comprehensive Plan Program. A motion by Commissioner Spitz, support from Commissioner Powell.
So, good afternoon now. Barbara Hankey, Director of Public Services. I'm filling in for Bob Gatt on this resolution to accept this very generous donation of $50,000 from the Martha Preston Trust Fund to the animal shelter. Miss Preston was an animal lover and had visited the shelter, and we're very appreciative of this gift. So we're asking for your approval to accept.
We do love to accept our. I
was just about to say, we don't complain about these.
Commissioner Spitz.
Is it slated for anything yet, or is it just gonna go into our?
This will go into our legacy fund that we use for special requests.
Any other questions regarding this item?
Nope.
Okay, and then Eric will talk about the Community Correction Plan Program.
Yes, hello, Eric Schmidt, manager with Pretrial and Justice Services. This is our annual application to the Michigan Department of Corrections Office of Community Corrections Comprehensive Plan. So we're seeking your approval to apply for $2,316,088 for fiscal year 26 to support 15 full-time positions, a part-time position, partial funding of 2 additional positions within Pretrial and Justice Services, as well as 2 full-time caseworkers, inmate caseworkers at the Oakland County Jail, which provide, again, services under our comprehensive plan. This is a continuation budget, and we're looking for your acceptance for us to apply.
Thank you. Any questions regarding this? Commissioner Cavell?
Yeah, this is a continuation. Is there, I know I'm on the pretrial justice services community group, so I should have asked about this in our meeting that I missed, so I get it. Sorry, Eric. But with this continuation, is there any COLA or thought to increase costs for the employees or county end of things, or is it just?
Right, so with concern for employee costs heading into FY26, the grant application is a competitive grant, so there's community corrections advisory boards from all over the state that are applying for roughly $14.1 million. We are basically competing with each other to seek awards. In order to be awarded additional funding, they look for increases in utilization, so people served and/or increases in programming. And we are going to be short on any increases in programming. I'm asking for the difference in the amount of money, right, to cover these costs. But it is not looking favorable for the award to come in at the $2,316,088. So we're anticipating a shortfall.
How big of a shortfall?
Honestly, we don't know. So if we receive a continuation budget of last year, that was $2,177,538. So about $139,000 shortfall.
And because the 14 million at the state is also not growing.
It is not.
Thank you.
Anything else regarding public service recommendations? Would you prompt the vote, please?
You have 6 yeas, 0 nays.
Motion's carried. Thank you very much.
Thank you all.
Our next item are from the Sheriff's Office. There will actually be 5 items on here. The first is an application to the state police for the 2026 Narcotics Enforcement Team Burn Program. The next three are agreements for law enforcement services with Paint Creek, the Michigan Renaissance Festival, the Somerset Collection, and item 13E is an agreement for participation with the Oakland County Sheriff's Office Sheriff's Search and Rescue Team Program. So item 13F, there's been some conversation while we've been in the committee. Motion to table the special event law enforcement services agreement template for non-contracted communities, and this item would come up on our next agenda.
Do you need to postpone to the next agenda?
We could postpone it. Do I need a motion for postpone?
Yes.
Okay, I have a motion by Commissioner Gershenson, support from Commissioner Spiz.
Question?
Sure.
Just item F, right?
Correct.
Oh, so it would be, is it A through E?
No, just item 13F.
Right, but you said there were 5 items, so G would still be on, or G is also gonna be tabled?
Did you refresh your?
Oh,
I don't have a G.
We got one, it's an amendment to it. Oh, G is removed now, never mind.
Randy's changing their mind. Just.
No, we got one in July.
Why table F?
My brief conversation during this committee is that there's more information to be gathered. And so discussions were underway with the Sheriff's Department, and it would return to our next agenda.
Does that interrupt anything for anyone with whenever these special events are? Like that one?
Well, it's not for, it is for it's a template. That my understanding is that there are some of our communities who would request law enforcement services, but our dates for our meetings and our board meetings don't work out for that. So the sheriffs would like to have a law enforcement service agreement template for those situations. So then those agreements would not be coming before the committee.
Yeah, Commissioner, if I may, basically, yeah, we're looking for a standardized template that will help expedite when someone has a request for service for the sheriff's office. Something that's standardized that we can, just process and get through quickly because time's always of the essence.
So you need some time to make the template or redo the.
Yeah, so there's some questions on the template. So it's a new template. What we used to do is it was called an auxiliary agreement with Wixom for fireworks. So it was a really, a kind of intense agreement for like one night of special event. And then obviously we get a lot of requests from other agencies too. So we're trying to make it, streamline it and make it so it's one template for everybody instead of like bringing Wixom or bringing, somebody back each time for one night event.
And you need another week or 2 or something.
So, yeah, and there's some discussions.
Yeah.
Okay.
Commissioner Benzo?
Yeah, I guess I was just curious, because typically by the time an item comes to the agenda, it's gone through discussion. I'm assuming Corporation Counsel, since this is a contract. So what is it that we're now pulling this off to discuss? Is it rates? Is it language within the template? Do you know, or is this all?
I just found out, so.
Yeah, we were just
I just found out.
So up until today, you were of the mindset that things had all been worked out, gone through the regular process, and was here for debate and discussion.
Well, yeah, we were for the discussion, obviously.
So I guess we'll all find out.
This hasn't gone to caucus, right?
Well, it wouldn't go to caucus until after,
Caucus
if it's coming to this committee, this committee would be approving it to send it to the board, which would lead to your caucus discussion. But I just was curious, because normally in my 18 years, when something gets to the agenda and it's a contract related item, it's gone all the way through the process, including, I would assume, Corporation Counsel review and sign off. So I was just curious, like, what went sideways? That's all.
And I agree with that. I'm happy to support a template that is uniform for all committees. My understanding is there's some conversation about these agreements not coming back to the board prior to signature.
Gotcha, okay. Okay, so, Madam Chair.
Yes.
I guess from my perspective, if it doesn't delay anything, there's no imminent contract that you're waiting on this template to sign, is there? No,
Yes, actually fireworks, because obviously fireworks are coming up, so.
okay.
No, it's not gonna delay the contract getting done.
What's that?
The contract's not gonna be delayed getting done by this
Yeah,
time.
we were told it wasn't gonna.
Okay.
Okay.
Yes, please.
So this is just to postpone.
Yes, to postpone.
You have 6 yeas, 0 nays?
All right, that motion carries, so we're back to our 5 items, the application and the agreements. So, we do have a motion.
I don't think we do.
Oh, we don't? No. Well, now we have a motion by Commissioner Gensel and support from Commissioner Christensen. Thank you.
Good afternoon.
I know.
Gabe here, Sheriff Fiscal Officer.
Major Rushizer.
John Brian Burwell.
Okay, so our first item is our annual application to the Michigan State Police for the Narcotics Enforcement Team. This application for fiscal year '26 is requesting partial funding to continue 2 sergeants at the sheriff's office and 1 principal attorney in the prosecuting attorney's office. There's also a part-time non-eligible office support clerk position that we're not requesting additional funding for because obviously funding's lower, or we're looking at funding cuts. So that PT&E position will sunset on September 30th. So if this application goes through and we get awarded, when we bring the award back to the board, we'll actually ask to delete that PT&E position. So.
Thank you.
Okay, the next item is with our renewal agreement with Pink Creek Trailways for part-time non-eligible mounted and bike patrol for the trails. And this is using the approved part-time non-eligible rates that were included with the law enforcement contracts earlier this year. The next one is a renewal agreement with the Michigan Renaissance Festival for law enforcement services. These use the approved rates for non-contracted overtime rates for full-time employees. The next agreement is with the Somerset Collection. They've asked us to continue doing patrols there. This one also uses the non-contract overtime rates, but it's a little bit different because it's based on availability. So this one, we don't guarantee any kind of staffing. It's just if people volunteer for the overtime shifts. So if there's nobody available, we don't force anybody to work this one.
Thank you.
And then the last one is a new interlocal agreement for the search and rescue team. So we're asking for your approval. There's a list of agencies that want to sign the agreement, including Waterford Township, Huron-Clinton Metro Parks, Milford, the DNR, Oakland County Homeland Security, the Incident Management Team, and Oakland County Animal Control.
Thank you. Any questions? Commissioner Cabell?
Thanks. You said you're getting budget cuts? What is this?
Well, all
grant
grants. I
budget?
mean, we're obviously worried about grant funding going forward, so in the case of this, and obviously salaries go up every year, so the grant amount typically stays right about the same. And so we get less funding for the positions, so they're discontinuing the part-time non-eligible to put more of the funding towards the full-time positions to maintain those.
So the erosion of the increase over time
Yes.
has led to it making sense to cut part-time staff.
Yes.
And this is, if it's a burn grant, it's federal money that the
Pass
state
through the
gets.
state police, yes.
Is there stuff going on at the federal level about burn grants getting cut?
Not that I've seen yet, but obviously everything's under, everything's under review and under consideration as far as we know. So this is just the application, and obviously I think things will play out and we'll see what happens with the award.
Okay.
Commissioner Christensen?
Yeah, you can refresh my memory. At one time, there was a discussion about the Safer Communities Fund getting a percentage or a portion of these contracts with outside companies, outside agencies. Do you remember that? Or, because I know we're doing that with the resource officers in the schools, but I need to refresh my memory. I thought there was some discussion too about our sheriffs contracting with outside agencies, but you know, I could check it out if it doesn't ring a bell to you.
Yeah, because the only thing it's tied to right now are school, like the amount is tied to the number of students in a district. So I'm not quite sure how that, how that formula would
Okay,
apply
I
to
know
an
it
outside
was
agency,
discussed,
yeah.
but it could have been on a much smaller level, it could have been discussed, but okay,
Yeah,
thank you.
'cause I don't know how that formula would work
Right.
with the student, so we'd have to figure that out.
Thank you. Any other questions, comments? Would you prompt the vote, please?
You have 6 yeas, 0 nays.
Motion's carried. Thanks for waiting with us.
Thank you.
Our next item is from the Oakland County Safer Communities Ad Hoc Committee. It's a partnership with Disarmory Ministries. I have a motion by Commissioner Gershenson, support from Commissioner Genzo. And I will defer to Commissioner Gershenson and Father Yaw, who's been online with us all this time to report
Really
on Disarmory
appreciate his
Ministries.
patience, for sure. So the Safer Communities Fund met about a month ago, and Father Yaw made his presentation. And on the committee is Commissioner Powell, Commissioner Lubes, myself, and Under Sheriff Willis. And all of us were in support of this proposal, so I'm gonna let Father Yaw explain it.
Thank you so much, Marcia. Thank you guys for saving the best to last. I'm Father Chris Yaw, as you know, and it's been 4 years that we've been working together to make our Oakland County communities safer. And I'm the president now of Disarmory Ministries, which is kind of the newer form of our gun safety ministry at St. David's in Southfield. We now hold a gun buyback, giving gift cards for firearms every weekend in Berkeley. And I want to just mention one or two vignettes. This woman, Kelly, came last weekend. She drove up to our site on Greenfield Road. She gave us 5 guns to destroy. She said when she was a kid, her dad, who was an avid hunter, had been cleaning them. One of them went off and killed him. And she said her family had been holding on to those guns for 30 years in the basement, not knowing what to do with them. So in 15 minutes, we chopped those up for her. Then there was Patrick. He's a policeman. He came about 3 weeks ago, and he gave us 3 pistols because he said he didn't trust his police department's property room to prevent them from going missing. And then there was a woman named Deanne. She came our first weekend in May. She gave me a pistol. It was brand new in the box. I said, "This looks new." She said, "It's been used once by my brother who bought it on a Tuesday and took his life on a Thursday." So this is what your funding is helping us do, is removing unwanted weapons. Many of them, people will drive up and they will tell me this was fully loaded in a dresser drawer for 30 years, in an attic, in a basement. These are from people who don't know, they don't want their firearms, so they don't know how to safely store them. We're doing this because, as we know, firearms are dangerous. They're the #1 cause of death for children. We know ready access to firearms greatly increases suicide risks. We have 1 gun suicide in Michigan every 11 hours. And certainly third, a high percentage of gun crime is perpetrated with stolen firearms. Our goal eventually is to change America's firearm disposal habits, create a convenient, economical, and safe way to dispose of unwanted firearms. The tough job is now, of course, getting the word out. And your funding, your support helps us do this. People read your newsletters and mailings. We need to get on the map of every community bulletin board, police blotter, pawn shop, gun shop counter to just let folks know that we're here. 1 out of 4 firearms in this country are owned by people who didn't purchase them. 1 out of 4, that's 100 million firearms. Certainly a significant number of those are unwanted. They get passed on from generation to generation, and with police departments stretched and no obvious place to take these, they sit around and they can cause problems. So Disarmory Ministries took in 92 firearms in May, and we think there are plenty more out there. People can make a reservation. They just need to go to our website, disarmory.org, and it's really easy. It's really convenient. Taking responsibility for community safety. It's not just up to law enforcement. It's up to all of us, the people, to take care of ourselves. As a pastor, I know it's not just like thoughts and prayers, but it's got to be action and change. So thank you for helping us do this. And if you or somebody you know has an unwanted firearm, go to disarmory.org.
Father, how many assault weapons have we collected? and destroy?
I think we've gotten 3 assault weapons so far. Okay. Just about almost one every weekend somebody brings one.
I mean, if anybody wants to see it, it's pretty unbelievable. This ministry has bought these saws, these specific saws, and once the person gives the gun, they chop it up. And there are people that actually make art out of the pieces, and there's some in Mike Andrews' office. There's a piece. If anybody's interested, I can pick up one on my next visit. But really appreciate everybody's support, including Under Sheriff Willis. Thank you.
Commissioner Spitz.
Thank you, Madam Chair. Marcia, you might just answer my one question. Sheriff's Department's fully endorsed this and been behind it?
No. Under Sheriff Willis has endorsed it.
Under Sheriff Willis has endorsed it.
I'm not speaking
Now,
for anybody else.
all these weapons that are being taken in, are they going through a background check to make sure that they're not on some police list somewhere as they use it in another crime?
Did you hear the question?
I sure did. Yeah, we write down every serial number of guns that have them because, as you know, they weren't mandatory till 1968, till the Gun Act, and so some of them are so old they don't have serial numbers. But we write them down and we pass them on to local law enforcement to upload to the Michigan State Pistol Registry with the state police. And we're also pretty. You know, we hire people to do this for us, and these are usually ex-police, certainly ex-military. And we don't take crime guns. I mean, if there's a ghost gun or something with a serial number scratched off, which we haven't had this year, we've had them in past years when we've done this with local departments. We are adamant about not wanting to deny any family justice for a gun that may have been used in a crime. But because of the long wait in the ballistics lab and this sort of thing, we don't actually do ballistics on them, but we do have the serial numbers taken down, and we are on the lookout for anything that looks sketchy. When the University of Michigan helped us do this last year, they sent research to every one of our 6 sites. Our average donor is 62.5. And so we're mostly getting a lot of guns, not a small amount, that may be broken, that may not pose might be valuable to a person, but if found by a kid or somebody in a suicidal state of mind, could be a real problem. But we don't tend to get a lot of like suspicious, fishy looking people coming up, but we're on the lookout for them.
You kind of answer my question, because that's my concern is somebody's looking to hide a gun, they take it to you, get a gift card for it, you destroy it on site, and now it's lost evidence.
Exactly, and we're on the lookout for that. We work in concert with law enforcement, and we have people pretty much every weekend who said, I called my local police department and they didn't want it, or they'd only take it on this day. We know that departments are stretched, and this is not a high priority item, which is why we're doing it. And so we're really vigilant. We were before the Berkeley City Council last night. I mean, we work in concert with law enforcement as much as we can. We're on the same side.
I was going to say many police departments, local police departments are in support of this. We've had.
And I agree they are, right? And like you said, some will take them, some won't because of whatever reason. That's my concern is, especially if you're just throwing them on site, has there been enough time when a weapon comes into you, do that check on that serial number to make sure it's not evidence before it's destroyed? That is my concern.
Okay.
Right? And based on what I just heard, I'm still concerned.
Okay.
And second, I would request that you talk to corporate counsel, because if Oakland County is going to sponsor this, are we
We're
now?
not sponsoring it. We are a contributor, but we're not sponsoring it. It's sponsored by this.
Okay, fair, whatever terminology we're using, but does that put us at a potential liability concern?
I did check with Corporation Counsel. I did at an earlier time, and they were not interested in issuing a statement. But they did not discourage this from going on.
I think we need to have another conversation, because I'm concerned.
Okay.
I mean, I love the program, don't get me wrong, but I'm concerned if a weapon comes in, it's in a crime,
Okay,
return
well,
the
just so you know,
number,
I did talk to
we
Corp
get sued.
Counsel before we went.
Oakland County get sued, because now we may not be sponsoring it, but we're promoting it to a degree. It's a concern for me.
I get it, and I did talk to Corp Counsel Phillips.
Yeah.
Chair, and you forgive me, it was a couple of years ago, and I
Right,
don't exactly remember, but I never would have gone ahead without approval
Well, it's fair, but the
of
program
Corp.
has shifted slightly from when we did it in the past, because we were taking the guns in and the weapons in, and they were going somewhere else and being destroyed, so they had the time to do the checks, all this. But if you're destroying them on site,
right,
you lost all that time.
Items that come through with the monetary value This item was reviewed by core council and they didn't have any comments.
But I don't know if they
made.
know what I just asked, that question.
Well, it's right in, it's
Or
right
they're being
in
destroyed
the,
on site.
it's right on, it's been that way for a couple of years. They've had
They're just-
these saws destroying on site for a few years.
And it's in our,
Not new.
it's in
Okay,
our
maybe-
resolution
It may not
that
be new, but it's shame on us.
they were,
I mean, to me, I'm concerned based on what I just heard.
after final review from Corporation Council and the Purchasing Division, it's the last sentence in our resolution. Commissioner Powell?
Yeah, and I was gonna say, I think if I'm not mistaken, that question was, a question similar to that was asked by Mr. Willis, by Under Sheriff Willis, and that's how we got the explanation of the processes and who all involved and
I
who
will call-
researched
I will
our,
call
yeah.
Mr. Sheriff
So
myself.
call,
I will
yeah,
call
please,
Mr.
just
Sheriff
call them to
Go
say.
right, go for it.
I will.
Okay.
Then my final question is, this $10,000 being asked, is that only advertisement in Oakland County?
So this committee doesn't have a huge budget.
I know.
Yeah, so this was the amount requested. We discussed it in great detail and this was the amount the committee came to.
But is it only advertisement in Oakland County?
Oh, that's a good question. Are we just advertising in Oakland County?
We're digital and we're certainly statewide, so it's going to be a little wider than Oakland County. But I also think that when we talked about this, you'd kind of remove that restriction. Hadn't you said that this is for, what, because we have a budget that uses.
The committee decided that the money should go to whatever they decided they needed. We didn't put a restriction on what the money should go for.
Yeah.
Because they do need a lot of help publicizing this.
And I hear all that, it just now. I'm
Mike,
concerned.
you're a no vote, go for it. I mean, we
Well,
don't need to discuss it.
I have a lot of questions. So-
Yeah,
That's fine.
it's whatever it is, yeah.
Any other questions?
Not to us.
All right,
He wants
would
to
you
talk to the
prompt
sheriff.
the vote, please?
I might change that, the board, we'll see.
You have 5 yeas, 1 nay.
All right,
Thanks, Mike.
motion carries. Thank you for waiting with us.
Thanks, Valia.
Pretty good work.
I need a quick 5 minutes for both.
All
y'all
right,
after this
we
meeting.
have now arrived at
Please.
public comment. Is there anyone from the public wishing to comment?
Anything you need?
You would have 3 minutes.
Okay.
All right, seeing none, public comment is closed. I don't see any other business to come before this committee, so we are adjourned at
Wow, what a
12:42.
good job.